I'd like to welcome you to this Tradition Deep Dive, hosted by the Contemplative Studies Centre at the University of Melbourne. I'm Dr. Colin Joyce. I'm an Insight Fellow at the Centre. I'd like to start the session with the acknowledgement of country. I'd like to respectfully acknowledge the traditional owners of the unceded land on which we work, live and learn. I'm in Naarm, in Wurundjeri, Woiwurrung and Bunurong peoples for the Kulin Nation. I'd like to pay my respects to elders past, present and future, and to any Indigenous people present today. So today we are joined by Susan Joachim, President of the International Nature and Forest Therapy Alliance. In this workshop, Susan will provide an introduction to the history, origins, and the well-being benefits of forest therapy. She will also discuss examples of current application in public health. So the first part of the session will be recorded, so please keep your camera and microphone off during this time. However, please feel free to post comments in the chat throughout the session, and at the final hour or so, there'll be ample opportunity for questions and discussions. So we'll bring people back to the room then. So Susan, welcome. Great to have you here. Thank you so much.
Thank you, Colin. And thank you to the University of Melbourne for allowing me to present and take this deep dive into the practice of forest therapy. I will start sharing my screen now. All right. I would also like to acknowledge the traditional custodians of the land on behalf of the International Nature and Forest Therapy Alliance. We would like to acknowledge that our work takes place on the lands of the Wadawurrung people. We acknowledge the traditional owners of country throughout Australia and recognize their continuing connection to land, waters, and culture. We pay our respects to their elders, past, present, and emerging. So my presentation today will take us on a journey to the origins and history of Shinrin-yoku forest therapy. I will present the theoretical framework, a definition of forest therapy, some of the benefits of the public health benefits of forest therapy, both direct and indirect, some of the research that started over 30 years ago and still continues, and I will introduce you to what happens on a forest therapy session. We will then go to practical activities, and I hope each of you have got a plant, or preferably an aromatic plant or a herbal plant, and we will do this activity for 30 minutes and then we'll go into Q&A. So the origins and history. Quite a few of us are already familiar with the word forest therapy, but Shinrin-yoku is the actual origin of this practice, which was coined in 1982 by the Japanese Ministry of Agriculture, Forestry and Fisheries. And what it means is forest bathing. And when we talk about forest bathing, it's not actually swimming in the forest or walking in water, but it's actually immersing ourselves in nature. And the characters represented here are kanji characters, where those beautiful diagrams or pictures of trees, of a collection of trees, represents the forest. And the last one, bathing, actually also contains elements of a person resting against a tree. So it really evokes this sense of slowing down, resting, and really immersing in the forest, in the atmosphere of the forest. And King Li, who is one of the leading researchers in forest therapy, and Shinrin Yoku, he describes it really well in this definition, which says Shinrin Yoku means bathing in the forest atmosphere or taking in the forest through our senses. It is not exercise or hiking or jogging. It is simply being in nature, connecting with it through our sense of sight, hearing, taste, smell, and touch. It is like a bridge. By opening our senses, it bridges the gap between us and the natural world. And I think that really encapsulates this practice. So, the origins of Shinrin-yoku forest therapy was actually promoted in Japan in response to a public health crisis caused by overwork and technostress. Some of us will remember that at that time, in that decade of the 1970s and 1980s, Japan produced a lot of all of our technological gadgets and equipment that we used. And that really put a lot of people under stress. There was long working hours, and actually the Japanese have a word for overwork or stress, and actually death caused by overstress, and that word is karoshi, death from stress. And we have heard of those stories from those days. The practice today also has economic, cultural, and scientific benefits of maintaining native forests to attract leisure and health tourism. Quite a few people today go to Japan in search of culture and also health tourism. And forest bathing, Shinrin-yoku, is very popular with international tourists. At present, there are 62 forest therapy bases in Japan across all prefectures. And down in the slide below is actually a forest therapy trail that was one of the first forest therapy bases, actually, which contains several trails, which were actually given the designation of a forest therapy base. And a lot of the science and the research was also conducted in Akasawa. I was lucky to be there, and I can tell you it's a really healing forest. And the Japanese have put in quite a bit of investment into making those trails accessible to anyone. So you don't feel you're jogging, you really feel that you're immersing in nature. Another aspect of Japanese culture and indigenous belief systems that influence Shinrin-yoku forest therapy is what we know as Shinto, which is actually Japanese indigenous belief system rather than a religion, which teaches that humans are an inseparable part of nature. It's also practiced as a life philosophy of living in harmony with nature and in a reciprocal relationship with nature. It is widely practiced and accepted in various personal ritualized practices as well. So there is quite an influence of Shintoism, which date back several thousands of years, that still, influence the culture, but also becomes part and parcel of what we practice in Shinrin-yoku forest therapy, that connection to nature through the senses and that reciprocity between us humans and the natural world. There's also a belief in Japan, and quite practiced. If you have been to Japan, you will see that there are shrines in forests along hiking trails and forest therapy trails, which represent kami. And kami are the spirits or the ancestors that are manifested in nature. And you can see from this diagram that nature and kami are present in the natural landscape, whether it's a rock, the sea, the water, or the mountain, and also humans. Some humans are considered very much kami, especially if you are well known in Japan. Once you pass, they recognize that some humans can also be recognized as kami, which is quite a fascinating thing, which also underlies the notion that we are all part of nature, not separate from nature. We can have this view of nature as the human being on top of a pyramid, and all of nature falls underneath that. But here, as represented in the diagram, we are all part and parcel of nature, which I think is a beautiful way to look at our relationship with nature. We will now go into a explanation of forest therapy and what that means. And this is going to be a little bit heavy, a lot of information, a lot of theoretical underpinnings, but it all is very important to understand what is forest therapy in the sense of a public health practice. This picture, actually, since we are talking to our audience from the university, this picture actually, which is one that I took my recent visit to the United States, and this is at the University of Charlottesville. It is a garden that is adjoining and adjacent to the university, where they encourage university students to take time off from their busyness and stress of exams and lots of study and assignments, to just take time off and go into this beautiful space that is right next, which is accessible, which is free to go to at any time, and just enjoy this quiet atmosphere and this quiet time in nature. So, the theoretical framework of forest therapy. Just take a moment to look at some of those words, and perhaps there are some that immediately jump out at you and say, yes, I understand. Yes, of course, it has to be part of the practice of forest therapy. But as you can see, there's quite a lot of different aspects that we have now brought into forest therapy, given the many, many, many years of research and also INFTA's involvement across the globe with various disciplines. From forestry, of course, we are talking about forest therapy. So forestry becomes very much a part and parcel of what we do and where we practice forest therapy, which means climate and weather, the environment, nature becomes very much a part of that. We are practicing in the outdoors. Biophilia, I will talk to you about that in the next slide. Certainly mindfulness and stress reduction, it goes hand in hand. We are quite often, we read a lot about mindfulness and meditation as part of a stress reduction strategy. And when you take those practices outdoors, it has a really powerful impact. Of course, psychology and psychotherapy, we are talking about stress reduction. So we immediately know the benefits to our health and mental health and well-being. Sensory perception. We talked about the 5 senses that Professor King Lee referred to. We're talking about how do we connect with nature through the senses. Neurophysiology, of course, we know that being out in nature has a wonderful calming effect on our neurophysiology and our mental health. And of course, we talk about public health. And what do we talk about in terms of public health? It's a preventative public health practice. As we go around the circle, we see that there are aspects of Qigong and yoga and physiotherapy. These are all practices that are incorporated into a forest therapy session. Physiology, we are moving our bodies. Aromatherapy, you will learn later on in my presentation what we mean by aromatherapy and phytoncides, a very, very important aspect of forest therapy, which I think the word is mostly and only known in the realm of forest therapy, because there was a lot of research that was done into phytoncides, which of course is our biochemistry, the biochemistry of humans, which is an interchange of volatile organic compounds between nature, between trees and humans, biology, and of course, biodiversity. A biodiverse forest is a very important aspect of a forest therapy session. And to the outside, on a broader scale, We are talking about politics. Why does politics become important? Because we want forest therapy to become a public health practice, to be recognized as a public health practice. And we need the buy-in of people who sit in Canberra and in all states of Australia and globally. We need politicians to advocate for forest therapy, nature therapy, and getting people out into nature, which of course has an impact on economics. Why? Because a healthier population means we are a more productive workforce, we are a happier workforce, which of course impacts on the economics and the economic health of a country. Tourism, of course, because there is more and more recognition of health and well-being tourism. Forest therapy, forest bathing is increasingly recognized as a very integral part of tourism, and people seeking meaningful tourism experiences. Why do they come to Australia? Why do they come to Japan? There is certainly a pull towards ecotourism and health and well-being tourism. And the media, why do we need the media? Because they play a very important part in creating awareness. The more people know about the benefits of a practice like forest therapy, the better it is that more people will get to know and come and participate and advocate for more access to green spaces so that they can go and have a relaxing forest therapy session. I spoke about biophilia. The biophilia hypothesis is a very important aspect and informs the theoretical framework of forest therapy. And what does biophilia mean? So the word biophilia is a combination of two Greek words, bios, meaning organic life, and philia, Greek for friendship or love. So it basically means affiliation or love of nature. And this term was first coined in 1964 and made popular, of course, by Harvard professor Edward O. Wilson, where he describes that what he believes is humanity's innate affinity for the natural world. That is his definition. And of course, he wrote a wonderful book. He examined how our tendency to focus on life and lifelike processes might be biologically a biologically based need integral to our development as individuals and as a species. And why does he say this? Just look at those statistics that are bold, that are in bold out there. Less than 0.01% of our species history has been spent in modern surroundings, which means that 99.99% of the time we have spent living in a natural environment. So the gap between the natural setting from which our physiological functions are adapted and the highly urbanized and artificial setting that we inhabit is a contributing cause of the stress state in modern people. And these were some of the statistics that came out of a research project that was done in 2016 by Miyazaki and others, the physiological effects of nature therapy, a review of the research in Japan. That's quite a startling figure when you think about it. Where we live now, it's over 50% of us now live in urban surroundings, which is predicted to increase to 70% by 2060. The other physiological aspects of the theoretical framework, we spoke about phytoncides. These are bioactive substances emanated from trees as part of their own immune system. And we'll talk in a little more detail about this later in the later slides. But this is a very important aspect of forest therapy and why we need to slow down when we go into nature and why we need really biodiverse forest to experience the true and real benefits of the practice of forest therapy. Sensory perception, being in quiet surroundings of the forest, allows us to strengthen our senses. So We speak continuously and always about senses, how we connect to nature through the senses. And one of those important aspects is quiet surroundings. It doesn't mean that we ignore the sounds of the forest. We certainly do. But when we talk about quiet surroundings, what we mean is free from urban sounds, the sounds of vehicles or traffic or noise or airplanes above us or helicopters. We're talking about quiet surroundings that are infused with the sounds of nature, not the man made sounds. The forest is also rich in oxygen, of course, charged with negative ions, which improves breathing and respiration. Another important aspect of human health and well being in relationship to the forest. Some of you may know these terms: the autonomic nervous system, which is comprised of the sympathetic nervous system and the parasympathetic nervous system. So you'll see on the left, quite a few of us will see ourselves in that picture, getting up in the morning, getting to work on time, the fight or flight, and the rest and digest, where we get the time to actually rest and digest and just be and calm down and bring down those cortisol levels. This doesn't mean to say that our lives have to be totally stress free. There are certain aspects of stress that get us up in the morning, and this is called eustress, eustress. So we need a bit of a cortisol boost in the morning to get us up, to get us going, to get us moving, to do the things we need to do. But what has happened in modern society is that acute stress has led to chronic levels of stress, and chronic levels of stress that stay with us at a continuous level throughout the day, which of course leads to lifestyle diseases and non-communicable diseases. So this is the modern lifestyle, and this is where forest therapy and learning, having those tools to help us to slow down when we need to and de-stress, really helps us to balance our life with moments and times of resting. The other theoretical frameworks that have supported the practice of forest therapy come quite way back in time in the early 1990s. The attention restoration theory, the stress reduction theory, and aspects of complementary physical and mental exercises. The attention restoration theory, some of you may be familiar with these two scientists and psychologists who are behind these amazing, quite groundbreaking research. The attention restoration theory proposes exposure to nature is not only enjoyable, but can also help us improve our focus and ability to concentrate. The stress reduction theory, which was research done by Professor Ulrich in 1981, assumes that viewing or visiting natural environments after a stress situation rapidly promotes physiological recovery and relaxation. And of course, forest therapy sessions employ complementary physical and mental exercises, which are medically and psychotherapeutically designed to help the participants achieve calm and de-stress and relaxation. Just take a moment to read what Edward O. Wilson, who passed away early last year, what he had to say about what the current human condition is and what we need to explore and affiliate with life is a deep and complicated process in mental development, to an extent still undervalued in philosophy and religion. Our existence depends on this propensity. Our spirit is woven from its hope, arises on its currents. Definition of forest therapy. So, what is forest therapy? If you go online and Google what is forest therapy or definitions, there are quite a few of them that have been proposed over time. In 2019, INFTA's board of advisory board and esteemed Professor Dr. Cotter, who was really instrumental in bringing people together from the field of forest therapy to actually look at what is forest therapy, what can we agree on a common definition. And this is what they came up with. Forest therapy is an evidence-based public health practice. And that's very important. We're talking about the public. So which means it's accessible to anyone. Guided forest therapy walks combine a specific blend of complementary physical and mental exercises in suitable forest surroundings, leading to a lower heartbeat, blood pressure, and stress levels, while at the same time, the immune system, breathing, and the overall physical and mental fitness and well being are strengthened. So that's a big definition, which offers quite a broad range of physical and mental health benefits. And we could make that claim because we have years of research, which I said still continues up to date. And we have this handbook. So, this International Handbook of Forest Therapy was published in 2019, and it contains all the research and some really good, insightful articles. It's not rich with just facts and scientific data. It also has some really good material which is almost instructional and tells you why it is good and how to do some forest therapy. Give it a go by yourself if you're really curious. So it's a really interesting read. Um, and Dr. Kingley was also one of the contributors. His wonderful book here, Shinrin Yoku, The Art and Science of Forest Bathing. I was just reading it before this presentation, and I realized there are still some things that I would like to know more about. So it's a really dynamic area of work, forest therapy, more so because we know we witnessed this and probably experienced it for ourselves, especially during the pandemic, when we realized how important it is to take care of our health in terms of preventative health, and also the need for green space closer to home when we were restricted to a radius of probably 5 kilometers if you lived in Melbourne. So being able to go outside and having that restorative environment right outside your door to help you to stay active, physically active, but also to help you to manage the stresses of the times in which we live. So it is really a dynamic field of work which we are very excited to continue to work in. Uh, uh, Together with our amazing network of forest therapy guides. So we talk about forest therapy in public health. So what is health? What are the definitions of health? Health. Just take a moment to read the definition which has been proposed in 1948 by the World Health Organization. It is a state of complete physical, social, and mental health, mental well-being, not merely the absence of disease or infirmity. So very important that we consider the physical, social, and mental well-being. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political beliefs, or economic and social conditions. I think that was a real breakthrough when that definition was proposed by the World Health Organization. It encapsulated a lot of things, both at the social level as well, political, economic, and social, which is a very important aspect of public health, especially now. INFTA recently started investigating what is public health in terms of the biopsychosocial model of health. And in our investigation and going back into research into the early 20th century, there was a proposition about health in terms of the biomedical model of health, which has dominated the thinking and actions of health practitioners for the last 300 years. We only looked at the biomedical factors, the genetic disposition, age, weight, stress levels. It was purely thought about in the medical aspect of health. Since 1948, psychological factors began to get recognition. Largely, the effects of two world wars, the WHO decided to establish a mental health unit, with mental health being recognized the fifth most important health issue at the time. So when we talk about psychological factors, we're talking about emotions, attitudes, anxiety, personality. So suddenly it changed from being just biological to also psychological factors that affect our health. In 1977, George Engel proposed a new model for medicine, a biopsychosocial model, which contrasted, of course, with the existing biomedical model. So socioeconomic factors became very important when we treated, considered, and looked at health. And what are these socioeconomic factors? Education, income, peer groups, lifestyle. There could be other factors that will be considered over time as more and more people in the medical field, in the research field, begin to look more closely and study the biopsychosocial model. Over time, and in consultation with a few others, INFTAs began to really understand, especially when we're talking about forest therapy, taking our work to an outdoor setting, the environmental factors of this model, which suggests that health is achieved through a combination of biological, psychological, social, and environmental needs being met. More so now, with the climate crisis the way it is, more people, everyone, no one can say, I don't know about climate change or the climate crisis. We live in an extremely and increasingly urbanized environment. Quality of our water, our food, the very air we breathe is compromised in our cities. Traffic, noise, all these environmental factors affect our health. I doubt any one of us would deny that. If you think about your own daily life, think about noises that you would rather live without. So all these, the very air we breathe, for me personally, going outdoors and having to contend with a polluted environment. If you look at, I think Australia is pretty lucky in our cities so far. But if you look at other countries like India, even the polluted environment in which people have no choice but to breathe that air. And we know these environmental factors can affect lifespan. There is research to show that pollution can create an early onset of dementia. So these are certainly factors that are becoming very much more important to understand and understand their impact on our health. Spiritual factors. This model proposes that spiritual factors contribute to the health of people over and above the known factors already accounted for. It is, when we talk about spirituality, There could be, of course, resistance to spirituality because people's understanding of spirituality can differ over a range of factors. Is it a religious belief? For INFTA and bringing in the spiritual factors into this model is more around our beliefs, our values, our traditions, and our practices. Over the last, I would say, 10 years, this aspect of spirituality, contemplation, and its effect on our health is increasingly being studied, researched, looked at, and in Australia as well. It certainly has an effect. The fact that we are having this presentation today from, supported by the School of Contemplation, for me, is another underlying factor that we need to focus on spiritual factors when it comes to our health. And I found very recently this association in Australia, the Spiritual Health Association, which I found really interesting. And I brought this into my presentation today because it helps to clarify what is spirituality. Despite people having different interpretations of spirituality, I think this definition really speaks to its impact on human health. Spirituality is a dynamic and intrinsic aspect of humanity through which persons seek ultimate meaning, purpose, and transcendence, and experience relationship to self, family, others, community, society, nature, and the significant or sacred. Significant or sacred could mean many things to different people, but this aspect of spirituality, whether it's our beliefs or values, traditions or practices, is beginning to increasingly impact on our health. And of course, nature. When we go out on a forest therapy walk, some of the practices that are introduced, quiet time, simply being able to walk in nature without without the distractions of technology, because our guides typically have people put off their phones. And why is that important? Because we spend so much of our time on our phones. It distracts us. So how do we support people to build relationship to nature? It's only when we take away that distraction and we bring in a practice which allows us for quiet contemplation and to just be in nature, to connect with nature. There are, some of the feedback that we get from people who attend our walks really emphasizes the importance of this aspect of purpose, of relationship, of this feeling that we are something, as a human being in this grand universe. It really brings to home something about who are we in the grand scheme of things? What is our relationship to others, to society? Loneliness is also a very, very important aspect of health and well-being today. When people come together in relationship with each other, with nature, it really does help to heal. During some of the walks that we conducted here in Melbourne, in the western suburbs, there were people who came on the walk, and at the end of the 2-hour session, they really were quite emotional, explaining to us how important it was that this forest therapy session, guided by two of our forest therapy guides, helped them to feel safe in nature, to feel safe with other people, given that we had just come out of the lockdowns. All these things emphasized the value of having someone there to support you in nature. You build relationship, you build community, not only with each other, but also with the natural world. All these things are really important and have a significant impact on our health. And how does forest therapy help as an intervention? We believe that public and mental health can be improved by means of evidence-based forest therapy as an effective and affordable standardized intervention. And INFTA will continue to work on this model and bring in more research and involve as many voices into ensuring that we consider all of these factors when we train guides, when we practice forest therapy, when we talk to public health officials, when we talk to media about the importance of bringing all these aspects when we talk about our health. Now, quite a bit of this research and evidence that I have presented in these slides can be found on our website. There is hundreds of really interesting research articles. If you go to our website, just look for what the topics that you are interested in. And you'll find quite a bit there that can help you understand the practice of forest therapy, but in general, just your health and well-being, your own health and well-being, that of your family, your community, and all of us at large. I will now play a video which was done by the World Economic Forum. It's quite a lovely one, so I hope you enjoy it. It's just about a minute, I think, so I'm just going to give that one a go now. So I hope that gave that you a little bit of a glimpse of what I've been saying about forest therapy, the benefits for adults, for children alike. Um, just this morning, I was talking to someone who had just applied to the forest therapy guide training. And I wanted to support this particular young lady because she brings with her a wealth of knowledge, but she works with children. So I said to her, please write to me and tell me what you're going to do with this training, especially with regards to taking children out into nature. Because I believe children are the hope for us. And as if we can get them out at an early age, as early as possible, and get them into that relationship with nature, that's going to be one of the key aspects of health and well-being, not for just us humans, but planetary health as well. We need to get children to love nature and protect nature because that's, I think, going to be our future. Okay, so public health benefits of forest therapy. Like I said before, all these benefits are evidence-based. There's a lot of research that has been done in Japan, in Korea, across the world. It keeps increasing by the day, actually. So all these benefits that are listed have a solid research and evidence-based foundation. starting with blood pressure, lower pulse rate. If you look at some of the World Health Organization statistics on non-communicable diseases, cardiovascular diseases ranks as one of the highest uh, that that affects our lifestyle, but also causes premature death. So our heart conditions are simply a result of lifestyle choices. So how does forest therapy help that? We get people outside. For me personally, as the president of INFTA, my goal is to get people off the couch, out the door, into nature. That's the first step. And because the practice is not about hiking and not about a sweaty jog, it's about a slow walk in nature. It is accessible to anyone, irrespective of your physicality, irrespective of whether you have run or never been active. It's a way to get people outside, because once you're outside, I'm sure we have all witnessed this or all experienced this, that even if you've had a really horrible day at work, just a short walk outside with your dog or by yourself or with your friend or your partner, you come back home just feeling a little bit better. So this is a known fact, which is also evidence-based. Of course, you feel less stressed, your anxiety is reduced, and the Japanese in particular have discovered that being out in a forested environment in particular um, is very effective in fighting cancer because of the phytoncides. And this is a word that probably some of you may or may not have heard about, but this is very important in terms of understanding the benefits of being out in nature, slowing down and being out in nature. These phytoncides are antibacterial, antifungal, anti-inflammatory, antimicrobial, and antiviral substances emitted by trees and plants. They are natural, volatile, organic compounds. And this is probably one of the reasons why we refer to this practice as Shinrin-yoku forest bathing, because the trees at certain times of the day and at certain temperatures, particularly as we go now here in Australia into spring and the weather gets warmer, the trees emanate these volatile organic compounds, and they bathe themselves in these phytoncides, which means the trees protect themselves from bugs, fungus, bacteria that are always fighting for survival with the trees as well and in the forest. But what the Japanese found out is that when we walk under these trees, we are bathed in these volatile organic compounds. And what they found is that our natural killer cells, or NK cells, as is referred to us, the number of natural killer cells increases in number as well as the activity. The activity is boosted. So the recommendation is to go for a 2 to 3 hour walk once a month. The more you do it, of course, the better. These natural killer cells continuously work to help us to fight anything that should not be in our blood system. It just improves our physical health, of course, our mental health as well. But this is a really important aspect of why we need to go out in nature. Like these two ladies here, we need to slow down. If we can, take off our shoes and walk in nature, but really taking that deep breath, really bring in those phytoncides. When we stand under trees, just not rush by them, but stand and really take that deep breath in so that these phytoncides really get into our system. Increased happiness and positive mood, of course, is something we all feel when we go out into nature, whether it's a forest therapy walk or not. Enhanced energy level and better concentration. So these are some of the direct health benefits that have been found to be benefits of forest therapy. What are the indirect benefits of forest therapy? So over time, improved immune system, increased overall fitness. The more we go out into nature, the more we are physically active in nature, when we move our bodies, that of course contributes to weight loss, the reduced risk of obesity, reduced risk of heart and lung diseases, better mental health. We feel less anxious, we feel less depressed or stressed, especially when dealing with day-to-day situations, better and more regular sleep, higher self-confidence and motivation with less mood swings. Wouldn't it be great if we can have all of these, experience all of these on a more regular basis? Um, I'd like to talk something about regular sleep. There's more and more evidence and more concern. And I guess we have all had sleepless nights over whatever, for whatever reason. But people are really finding it hard to fall asleep because of thoughts of anxiousness or concerns or stress. And also people may sleep, but they don't have deep sleep. And all these have an effect on our health, both physical and mental. So we know when we go out into nature, and especially on a forest therapy walk, we, on the one hand, feel really energized. We feel, alive again. And at the same time, it gives us this nice feeling of restfulness, which then helps us to fall asleep and sleep longer and sleep better. And there is anecdotal evidence, there are quite a few people who actually write in after a forest therapy walk. And there was a lady who commented on this just about a week ago, and she wrote in and said, "I've had the best sleep I've had in years. So thank you for this opportunity. Thank you for offering these opportunities for us to come and experience forest therapy, because it makes a huge difference. It has made a huge difference on the way I sleep, and I just got up and I felt much better the next day." Again, all these indirect benefits have also been evidence-based. You can find it in the handbook, like I said, or also on our research link on the website. So to cap it, immune system, we spoke about phytoncides, boosted through the respiration of phytoncides, which increases our natural killer cells, helps with cancer prevention. The cardiovascular system, I said, is a very important aspect of our health these days, non-communicable diseases. Cardiovascular system is certainly contributing to increase in the cardiovascular diseases, not only in developed countries, but also more and more so in low and middle income countries. I presented just on Monday to an audience in the global south, and it was quite interesting for them to see how these figures also impact on health in global south. We used to think that these diseases are only part and parcel of people in more affluent countries, but it is also affecting people across the globe because of stress, mostly due to stress, physical inactivity. The respiratory system, we know that inhaling oxygen-rich forest air charged with negative ions and phytoncides supports respiratory immune function. And as I alluded to the fact that how do you achieve this when we live in more polluted urban cities? Just taking a breath of fresh air is almost impossible these days. So where do we have these opportunities? What do we do about ensuring that we have access to clean, unpolluted air? Mental health, of course, we probably have all experienced how good it feels when you go out after a stressful situation or a stressful day and go out for a walk. Nature, any kind of nature, not just forest therapy walks, decreases adrenaline and cortisol levels, helps to manage depression, chronic stress, anxiety, and overall cognitive health. supports better sleep. A very important aspect. If you just Google about the concerns around better sleep, you'll see that more and more younger people, and we know part of that is because we take our phones to our bedside and we continue to read and we have these blue lights on. We need to change our habits as well. So, what happens on a forest therapy walk typically is that the guide suggests to the group, shall we just all take out our phones now and switch off? Let's switch off from our technology and tune into the notifications from the forest. And you'll find people, they have a bit of a laugh and there's, smiles around. But at the end of the walk, and I happened to be in the Royal Botanic Gardens 2 weeks ago, and at the end of the walk at the tea ceremony, uh, one of the participants just said to the guide, I'm so happy that you encouraged us to put our phones away, because when I booked in for this walk, I thought, oh, this would be a fantastic opportunity to take pictures at the Royal Botanic Gardens. I haven't been here for so long. And what a difference it made that I was encouraged to not do that, but rather really immerse myself in the experience and use my sense of sight and sound and smell and taste and touch, rather than being on my phone, being distracted by my phone. So, a simple thing, I say to people, it's as simple and as difficult as putting your phone away, and that contributes to better mental health. Just a suggestion, maybe you want to try that out next time you're walking, to take a walk out. Just put your phone away for a while. I had to include this picture of my sister and me. I was in the United States. Of course, I had to go to the John Muir Woods. If you're ever in the United States, in San Francisco, I would strongly encourage you to visit. It was a vision of a man to protect these magnificent trees. You don't have to know about phytoncides when you go into a forest like that. It's just infused with the smell of these beautiful coastal redwoods. And, it reminded us that just as John Muir had a vision to protect those trees so that we could still enjoy it and the next generations could enjoy it, it's because he thought about the future. And the future will belong to the nature smart, those individuals, families, businesses, and political leaders who develop a deeper understanding of the transformative power of the natural world and who balance the virtual with the real. The more high tech we become, the more nature we need. Richard Louv. Now, Richard Louv was one of those people who coined the term nature deficit disorder. That was at least 20 years ago when his book came out. And it applies even more so today. The more high tech we become, the more nature we need. So, delving a little bit more specifically into the research on forest therapy, um, surprisingly, which very few of us know, the first wave of research that actually supports forest therapy came out in the 1930s. Following positive experiences to combat tuberculosis in forested spas across Europe. So children especially were taken away from very polluted urban areas in the Soviet Union and taken into forested environments and spas across Europe, and they found that children recovered faster from tuberculosis, which killed many millions of people at that time. So that gave rise to why was that? What happened? What was some of the reasons? What are the reasons for that positive effect on health? And we'll come to that in my next slide. The concept, of course, since then became well established in Japan and South Korea, with some, of course, slight cultural adaptations and therapeutic modifications, also known and growing in other industrialized countries like China, Taiwan, Germany, Austria, and of course, Australia. And INFTA fosters collaboration and research because we believe that when this forest therapy as a practice has real potential across the globe, and we will continue to collaborate nationally and internationally to make sure that eventually our goal is that forest therapy becomes part and parcel of the public health system. That's what we want, so that anyone can access it, irrespective of their economic condition. So I spoke about phytoncides, and this is the man who discovered it, a biochemist by the name of Boris Petrovich Tokin in 1928. He was the man who actually discovered it. And for a long time, nobody, the research was done and it was filed away somewhere. Nobody knew, did anything much more with it. He was the one who discovered about phytoncides emanating from trees and plants and how that affects our health and how it speaks to our own immune system, which was quite a breakthrough. And today, phytoncides are used even in pharmaceutical products. It has a lot more application and certainly much more promise in future scientific research. And I think even Australia has still to discover quite a bit in this area, given that the trees that we have, the very special medicinal trees that Aboriginal people have known for thousands and thousands of years, have still to be discovered. What are the phytoncides? And we do get this question, what are the phytoncides in Australian forests? I mean, all this research was done, great that it was done in Russia and in Japan, but what about Australia? So definitely, yes, we know that there are phytoncides from eucalyptus trees, from trees across Australian forests, rainforests, and the like, but it has never actually been properly researched. So there's a whole opportunity there for research institutions, universities, to establish the benefits of phytoncides in Australian contexts. This is more or less a confirmation or reaffirmation of what I've been saying since 1983 and continues onwards today. The benefits of forest therapy, especially in regulating pulse, systolic, diastolic blood pressure, and increasing blood oxygen level, and natural killer cells. So Dr. King Lee has this amazing book, Forest Medicine, which goes into deeper understanding of the medicinal values of trees and plants and forests and its effect on human health and well-being. It's a really good book, and I think every university and practitioner who wants to dive in more into the medical side of things of forest, this book is highly recommended. I may be going to Japan next month because he's going to present a new research paper on forest medicine, and I'm happy to share that later when I come back as well. So it's an exciting area of research, and something that Australia should begin to look at as well, especially since we know that forests are under threat. There is a change of heart now, and some of our forests are not going to be chopped down as was planned. So there's this potential for Australia to actually take the lead in researching and bringing out the findings and telling us why it's good to be out in nature, simply put. Some research that came out of Korea also emphasized again and supported the claims of the effect of phytoncides on stress relief, sedation, improvement on learning ability and concentration, and strong antimicrobial properties. This research is available through our website as well. But again, as you can see, the research continues. And stress relief, of course, is very important for relief, refreshing, ability to concentrate and learn, and of course, antimicrobial properties against disease. Of course, there's a commercialization aspect of it, but why not? If it's a natural product and if it's good for health and well-being, and if it's produced ethically, phytoncides can also be accessed in shampoos or sprays or aromatherapy products. What I would like to mention here, particularly about South Korea, is in 2015, forest therapy was actually introduced into the Forest Welfare Promotion Act, where each citizen is entitled to forest therapy, such as treatment which is prescribed by a general practitioner or specialist doctor. So what this means, when I was in Korea, I visited a forest therapy center, and with this Welfare Promotion Act, what that meant was people who could not afford to go on a paid forest therapy session could actually apply for funds. And I saw groups of people who were brought in a bus, so probably people with physical disabilities were brought in a bus, and they stayed for like a couple of days, and they went on forest therapy walks with their carers. Some of them were on wheelchairs, but you could see that it becomes more accessible when the government approves it with an act, so that people can apply for funds and get vouchers to go and experience forest therapy or be in nature. Their kitchen was amazing. They had all these vegetarian healthy food. So it's just not that you go in a forest therapy walk. It's a whole package of health and well-being, and forest therapy is part of that. And the forest therapy base is set out, it's landscaped, it's designed so that people can be out in nature without the sounds of without urban sounds, and just be in nature for that weekend and really immerse themselves and get all those benefits that I've been talking about. And Korean government continues, like I said, to invest into research and development so that these phytoncides really become accessible to the general public. Last year, INFTA was able, so we have a sister organization in Germany, INFTA Germany, that was able to get quite a substantial grant from the federal government to conduct research into clinical forest therapy, because in Germany, the naming of forest therapy was a little bit more defined in terms of a clinical approach to forest therapy, because that meant there was recognition from the government. And of course, that meant our research had to also align with that practice of clinical forest therapy. And I was able to go to Germany to support the guides, because all these walks were conducted by INFTA forest therapy guides. So what happened was we had people between the age of 18 to 80, so there was quite a wide range of ages. And we selected 3 different forested locations randomly, as people were randomly assigned. And each person took part in 2 or 3 standardized forest therapy sessions of 2 hours each. And of course, prior and after each forest therapy session, a range of medical and psychometric data were recorded. So that information, all the data is now being analyzed, and we expect the first reports to be out by early next year. And that was basically the sign that we had out so that people knew where the starting point was. It was a beautiful time in Germany. It was summer, so we got quite a bit of good participation. And the funny thing was, people came, some, depending on where you were assigned, you probably ended up having 3 sessions in a week or 2 sessions in a week. And we wondered whether people come to the same trail, maybe with a different guide, but the activities were all the same. We all followed the same forest therapy guiding sequence. And we wondered whether by the third session, people would be bored because they knew what was coming. But it was so surprising because the feedback we got was quite the opposite, because they said the first session was, what is this forest therapy? What will happen? What am I supposed to do? And it was like almost a learning experience. They did feel better, they felt more relaxed, but there was a certain anticipation to come to the second and the third walk because they felt that having learned these skills of slowing down, it's a skill, really. It is a skill to learn how to slow down and put off your phone. But there was an anticipation. Now that I know what to do, I can really go deeper into these activities. What more can I do? How more can I deepen my relationship with nature? So that was quite a revelation for us, that even though you offer the same activities on the same trail, people felt there was something more with each repeated session. And this is why we call forest therapy a practice. The more you do forest therapy, the better the effects. You feel it. You really do feel it. And the same was experienced when we conducted research since 2019 at the Royal Botanic Gardens in Melbourne. Each of the guides had their mobile phones with them, and it was totally voluntary. People were asked to answer some simple questions on a profile of mood state. And after each walk, people were asked the same questions. And analyzing that data, we could see that people's perceived levels of stress meant that they felt that there's significant drop in stress levels of about 40%. Now, this was just a small uh, uh, research project. There is certainly scope for larger sizes with repeated walks, more people across all states in Australia. So there is huge potential for us to consider having more research into forest therapy and what that means for people. How do they feel before and after a walk? Even in a botanic gardens, people might ask, what's the difference between a forest, a real forest, say like in the Otways or in the Dandenong Ranges, or wherever you find a forest in your area, as opposed to a botanic gardens. What I say to people is botanic gardens in Australia in particular, and I think most botanic gardens in major cities around the world, have been established quite a few decades ago. And the trees are quite significant. They have grown quite large. They offer a lot of shade. There's a lot of bird life. And the guides make it their, their mission to look for trails that really use the most forested, the most tree covered in the botanic gardens. So you feel that you are really leaving the urban life and just the green lawn into a forested environment. And if you go to the Royal Botanic Gardens in Melbourne, you'll see that the gardens have really done a fantastic job. They have this beautiful fern gully, they have a beautiful oak lawn. So the benefits, I would say, are on par with a forest therapy session in a forest. Not the same, I definitely would agree to that, but almost as good as. Because the other aspect is people people are able to get to a botanic gardens much faster than they would have to travel to get out into a forested environment, which is far, like an hour or two from home. So we are trying to bring this aspect of ease of access as well for people to enjoy forest therapy. And that is something you'll get a bit of an idea of what a POMSE is and what are the questions that are asked. It's very simple, takes no more than a few minutes, the way we did it. But I said there's much more scope for this to be extended. Profile of mood states, and A means adults. Probably need to rush through. I have a little bit more time. So this is some of the research that we conducted here with Colac Health, with Deakin University. We have got some grants from councils across Australia. So that means that people could come to these walks without having to pay for it, which is always great and which is very appreciated. And we want more of this. You know that each council across Australia has a health and well-being strategy. And we would like if that health and well-being strategy includes free community walks, free forest therapy walks for the community, because it works. Like I said, forest therapy is not just a walk in the forest. It is not walking or hiking, which is not a bad thing. We need to walk, we need to hike, we need to get our heart rate going, we need to be physically active. But then there is also time for slowing down, where we are not preoccupied with physical exertion or distracted by technology, but to really immerse in the atmosphere of a natural environment so that we can experience the benefit of multisensory connection. And we spoke about the senses over and over again. The science and the research and the evidence shows that a forest therapy session takes into account all the senses, whether it's the visual, the auditory, tactile, olfactory, gustatory, vestibular, interoception, and proprioceptive, to name a few. So all the forest therapy walks, all the activities that we do take into account this sensory connection to nature, the visual, the seeing, the beautiful light, the patterns, the soundscape. We know that sound of birds is very relaxing. Tactile, what are we touching these days? Screens, our phones. Where do we experience natural textures? We have to really make a deliberate effort to connect with nature through all of the senses, especially textures, all kinds of textures, the rough, the smooth, the smells. We know the smells of nature, the wonderful smell. We go into a garden, whether it's the soil or the plants or the herbs. Taste, everything we taste comes from nature. Our sense of our place, our body awareness. How do we walk? How often, how many hours do we spend sitting? We need to be moving. Our bodies are meant for movement. How do we know whether we are in the right balance? We need to move. We need to understand our body in space. How do we know that if we close our eyes and we put our hands out? Just try that. Close your eyes, put your hand out, and see whether you can find your nose without opening your eyes. We can do that because this is called our vestibular sense, our body awareness. And of course, interoception. We know when we are hungry, we are thirsty, whether we need to use the toilet or breathing. These are all the senses that are brought into a forest therapy session. I have taken hikers on forest therapy walks, and they have come back to me and said, Susan, when I am hiking, I'm really walking fast. I did not notice that when I slow down, I'm actually having problems with balance. I didn't notice that till I slowed down. And so this is another reason why slowing down helps us to really tune into our bodies, a sense of interoception. Usually our forest therapy walks are 2 to 3 hours, slow, quiet awareness. We walk with quiet awareness. We sit and pause on easeful trails, which are accessible to all levels of fitness and suited for all age groups. We don't walk more than 1 or 2 kilometers, and the structured sequence or the standard design employs complementary physical and mental activities which are research based and achieved to calm and de stress clients effectively and measurably. I'll tell you, this is the most looked forward to activity, unless you have never been to a forest therapy walk. Typically, at the end of the walk, the group is sent out to just be in nature, to find a quiet spot. And when the forest therapy guides calls the group back, they are presented with this beautiful setting, typically a mat like what you see on the ground there, and the guide offers hospitality and a fresh cup of herbal tea, which is usually made from leaves or herbs from a forest, typically an Australian plant or herb. And this is where really people come together. They gather in community, and we share a cup of tea. We share a cup of tea with the forest as an expression of gratitude. Some forest therapy guides read nature poetry, but it's also a wonderful opportunity for people who are participating in the walk to share what this experience was for them. And in that sharing, there is also learnings. Someone might say, like I mentioned, it was great to not use my phone. Another one will say, I noticed a certain plant or the unfurling of a fern for the first time, only because I was slowing down and I was given permission. That's a very important aspect of forest therapy walks. We don't tell you what to do. We offer you the experience for you to experience in a way which is right for you. We suggest, we don't prescribe. And this is where forest therapy becomes this really beautiful, inclusive practice as well. And no one goes home empty handed. At the end of the forest therapy session, each person is given their personal forest therapy prescription with the name and the date and recommendations for your daily dosage, a weekly dosage, and a monthly dosage of nature and forest therapy. So as for the daily dosage, it's things around finding a quiet spot even in your own garden, on your own balcony, with your cup of tea, just close your eyes, no phones, no Instagram, no Facebook. Just close your eyes and just be in nature. Do that for as often as you can. It doesn't have to be hours. It doesn't even have to be half an hour. It could be 5 minutes. It could be 10 minutes. We recommend 15 to 20 minutes, but whatever time you get, just take that time off to be with nature and with yourself. Give yourself that permission to do that. The weekly dosage is to step outside, go for a walk with a friend, probably without your phone, and just, even if you're having your brisk walk, stop occasionally to notice what's happening in nature. Maybe you see a bird or a cloud. Just stop for a moment and have that connection. And of course, the monthly dosage is a session of forest therapy in a botanic gardens or wherever you find a forest therapy guide. Go on a session. You meet people. You will feel welcome. You will feel supported, so that you can deepen your practice and reap more of these benefits that I have been talking about. And these are some images of forest therapy walks that have been conducted around Melbourne in particular. Do you get the feeling looking at these pictures that people are feeling rushed, or they are sweaty, or they have exerted themselves? What do you feel that they feel that they are relaxed. They are really connecting with each other, with nature. What is the sense you get looking at these images? What are people doing? That's typically what we help people with to come on a forest therapy walk. You are guided, you're supported. You don't need to know what to do. We help you to connect with nature through the activities that we offer. And it's accessible to anyone of any age, of any physicality. You really feel the benefits on a forest therapy walk. INFTA's global network, you can find this also on our website. So if you're looking for a guide in your area, you can go to the website and find a guide. Their contact details are there. We continue to expand. There are, of course, areas which are still uncharted territory. We are opening up more opportunities for guides by making the guide training more affordable for people in the global south, so that tour guides can offer forest therapy as tourism, for employment, for inclusivity. And we welcome anyone who's present here today to reach out to us, and so that we can broaden our network. We certainly welcome research partners, practitioners who really have a love of nature and believe that actually access to nature is our basic birthright and it's a human right. And we can only make this happen if we have a broad network of people who are really pushing for a public policy in this area as well. Finally, some images from some of my travels over the last couple of years. On the top, of course, I have to say massive gratitude to Royal Botanic Gardens, Melbourne, for continuously advocating for forest therapy. This picture on the top left is seen at their reception. Right as you walk into the visitor area, there's this massive screen and forest therapy is featured. So people who come to the gardens who have never heard of forest therapy at least make an inquiry and they book in. And that's the kind of advocacy we need. On the top right is a sign from the National Forest Healing Center in Korea. Professor Wonsop Shin, a few years ago, he really welcomed me and he opened the doors for me to discover what forest therapy, what Korea has done to facilitate forest therapy and make it a public health practice and have an act actually. It was wonderful to go and see how this practice has developed over the years. On the bottom right is, of course, a sign from Akasawa. I spoke about Akasawa Forest Therapy Base earlier. This is a sign which shows the level of phytoncides, the different phytoncides in the Akasawa forest. So there's alpha-pinene, quite a high concentration of alpha-pinene in that forest, because people want to know what is the benefit of forestry? What can I see? Where is the evidence? Why am I here? And this sign clearly shows you are here because, and this forest is a certified forest therapy forest because of this, because it has all these benefits for your health. So that's really an affirmation as well. And we would like to have more of these in Australia as well. And of course, last but not least, on the left-hand side, I was in the San Francisco Botanic Gardens, and I saw this little girl, with her little raincoat hopping along, and she looked carefree and happy. And in my mind, this is what we need. We need to bring children out into nature, less technology, less work stress, less homework. Homework is great, study is great, but we need to balance our children's lives and give them, because they are really the hope for us. And on that note, I would like to end my presentation.
So yeah, thank you everybody for coming, and thank you, Susan, for presenting today. It's a wonderful, really, really helpful approach. And just for our sake too, at the centre, if anyone could fill out the we have a feedback survey. So if you do have time, we have some suggestions about format or topics or opportunity. If you'd like to spend more time on something or less on another thing, just let us know. And please, subscribe to our newsletter to stay informed of upcoming events that we're hosting. And I think sometimes we're also we are connecting, I think, with some of the forest therapy work here as well. So hopefully there'll be opportunities for sending things out there as well. But I, just have to keep that on the table. But it's really great to hear, and I hope everyone gets a chance to go off and experience it.
Indeed.
So, okay, all right.
Thank you, everyone. Thank you.